For a checkup, I could be at 12 o'clock, but actually I don't do that very much. But if I'm doing a smile design, I might do, because I want the midline. But for routine checkup, I'm just going to sit like this, and Sally's going to pass me the instrument. And I've got loops on, all right? And coming to loops, I'm just going to explain something to you. When you try and look in the mouth, you're trying to get rays of light coming from a tooth to go to the central part of your retina, the very back of, because that's where it's best in focus. So what we do is we tend to drop our eyes to look at things, and then our head follows. So once your eyes move 30 degrees downwards, your neck will follow, your head will follow. So you do this, and you want to see things, so down we go, and we start working like this. And if I'm doing that, then Sally has to do the same thing. So we have to try and sit and use the correct loops in this position. And then my field of vision is very small, so I can look at you, and the instruments are still being passed very safely. I can't see them. I have no idea when they're coming to me, but it's still safe. So, having done all of that, we've done our checkup, and we've done the local, and now we want to do dentistry. What do dentists do next? What do dentists do first thing? No, we're having done our anaesthetic, yeah? What happens now? I've got a drill in one hand, and I've got a... They do it. Well, they don't. That's the point. What dentists usually do is they go into the mouth first, because I'm the dentist, I'm the important one, I've got to drill the tooth, you've got to work around me, off I go, I want to drill, where are you going to go? Okay, and that's where Sally goes, and that's the position you work in. And that's just manifestly wrong. So, let's change it. Okay.
Okay, so again, I'll say again, because I can't emphasise enough, this is really, really important. The nurse needs to sit very, very close to the patient. You know, I tend, you know, if I'm not close enough, I will tweak Martin out of the way a bit, just so I can get close, so I can see what I'm doing. I'll use a 3-in-1 syringe to do my retraction, or you can use a mirror if you haven't got a 3-in-1 syringe. So I'll retract the cheek, if we're working upper left, retract the cheek, place the aspirator in,
I'm very sorry.
and then retract here to fully open up that side of the mouth. What I'm trying to get is as much light into the area and get the soft tissues out of the way.
Okay, once we've got a nice open space, this is completely different for me because I'm the dentist and I can see what I'm doing. Finally, I can see the tooth properly with indirect vision. And all I've got to do is get my mirror into the buccal sulcus, use my indirect vision and drill away.